Mr. President, I listened carefully when the senator from Kentucky came forward, his statement on the floor this morning. It was a lengthy defense of the procedure that's being followed in terms of the nomination of Amy Coney Barrett to the Supreme Court. It's not the first time he's made this historic defense, and clearly he is going to continue. He obviously feels that he's on the defense when it comes to explaining it. I think he is. I think everyone remembers Merrick Garland, the pronouncement by Senator McConnell and all of the Republican senators that Barack Obama did not have the authority in the last year in office to fill a vacancy on the Supreme Court. When he sent the name Merrick Garland to the Hill, Senator McConnell let the word go out that he would not even meet with the man in his office. He would not show him the respect of meeting with him. 2 or 3 Republican senators broke with that command from Senator McConnell, but most went right along. It was a very low moment. It's one that we haven't forgotten, and I don't believe the American people have forgotten, because we've rewritten the rules. And now when it comes to a Republican president, Senator McConnell says, well, of course he can fill the vacancy. He can even fill it while votes are being cast in his reelection campaign. It's an enormous departure from 4 years ago. And Senator McConnell comes to the floor regularly to try to explain it away, and it just doesn't work. He'll keep trying. He has no alternative. But if most Americans tuned in to this hearing, this session this morning and afternoon, I'm not sure that they would dwell on the rules of the Senate or the rules of the Senate Judiciary Committee. They would probably be asking themselves and the members of their family a very basic question. What's wrong with the Senate? Doesn't the United States Senate know what's going on across America? This morning's New York Times front page. New peak for U.S. cases, over 82,000 in a single day. 13 states endure their worst week yet. Warnings of a cold weather surge. The article, of course referring to COVID-19, says, the United States is in the midst of one of the most severe surges of the coronavirus to date, with more new cases reported across the country on Friday than on any other single day since the pandemic began. We sit here arguing about the rules of the committee and the rules of the Senate and who came first and who shot who. The American people would like us to focus on something that has real relevance to their life. Listen to some of the things that are reported this morning in this newspaper about what's going on across America when it comes to this coronavirus. On Thursday, the same day that President Trump said the coronavirus was, quote, going away, close quote, and Joseph Biden warned of a, quote, dark winter ahead, close quote, the United States recorded one of its highest daily totals of new cases, 75,064. By Friday evening, a new peak in the pandemic had been reached when more than 82,000 cases in a single day were reported nationwide, breaking the daily record set on July 16th by more than 3,000 cases. 13 states have had more new infections in the past week than in any other 7-day stretch. Hotspots are emerging across the country. Officials in Kentucky announced more than 1,470 cases on Thursday, the biggest one-day jump in that state. More than 1,300 cases reported in Colorado, another single-day record. And in the state of Washington, Governor Jay Inslee tweeted that the state had passed the 100,000 case mark, adding that, quote, we all need to commit to having fewer, shorter, safer interactions, especially as the weather keeps us inside more often. Mr. President, that is what's happening in America. It's not what's happening on the floor of the Senate. We're embroiled in a political controversy over a Supreme Court nominee instead of focusing on the deadly situation that's going on across our nation. I've spoken to Governor Pritzker, the governor of Illinois, regularly about his battle to try to find equipment and treatment for the people in our state. It's a lonely, unpopular battle that he fights. This governor in Illinois, as governors across the nation, have to stand up, if they are responsible, have to stand up and say to the people, the residents of their states, some things that they don't want to hear. I don't like wearing these masks. Most people don't. but it's a simple, effective way to dramatically increase the spread of this virus. I don't like the notion of social distancing. I certainly don't like the idea of being away from my grandkids and the rest of my family. But if it means keeping them alive, I'm going to do it, as painful as it may be. These are the simple, basic things that we are now debating from one end of America to the other. This coronavirus situation has reached such a terrible state that yesterday, when the Director of Public Health for the state of Illinois gave her daily briefing, Dr. Ezike is her name. She's a wonderful African-American doctor who has just been steadfast through this whole battle against the pandemic. In the middle of her presentation about what was facing our state, she broke down crying. I would have too. She turned her back for a moment, tried to compose herself, and could barely finish her press conference. She begged the people of my state of Illinois, please, if for no other reason, for the sake of the healthcare professionals who risk their lives to treat these people, please help us put an end to this virus. Last Saturday, Mr. President, a week ago today, one of my dear friends for years and years was feeling sick, called her daughter and said, I think I need to go to the hospital. Her daughter took her to the major hospital not far from their home for admission because of lung problems. The hospital would not accept her. All the rooms were full. She then went to the second largest hospital in the area, asking if she could be admitted and treated. They would not accept her. All the rooms were full. She finally made it into the third hospital. She survived until Tuesday morning when she passed away. In the United States of America, that someone who had health insurance, was prepared to pay, could not even be admitted to major hospitals because of this coronavirus pandemic. And we are sitting here on the floor arguing about who was appointed by which president 100 years ago. Do you wonder why people look at the Senate and say, you're irrelevant? You're not even addressing the issues we care about. And the procedural play here means nothing. Oh, I've offered an amendment, you voted no. And the people at the bottom line say, grow up and do something to help America. We know what it takes to reach an agreement, as we found on March 26, when we passed the CARES Act. Passed it in the Senate with a vote of 96-0, a bipartisan, strong vote, not a single dissenting vote. $3.3 trillion to address this pandemic in our economy. We rose to the occasion, and I went home and people were amazed. Do you mean you actually did something in the Senate? Yes, we did. How did we reach that point? It wasn't through the regular order, it was through honest, serious negotiation that took place between the White House and the leaders in Congress. But since then, we've not seen that. There has been one group that has stayed away from all of the negotiations around a table. The White House is there, Secretary Mnuchin is there, Speaker Pelosi is there, Chuck Schumer, the Democratic leader of the Senate, is there. The Republicans have refused to sit down and negotiate at the table. That's how it gets done around here. People sit down and work out their differences and put a bill on the floor and pass it 96-0. But Senator McConnell has steadfastly refused to attend these negotiating sessions. Kevin McCarthy, the House Republican leader, joins him. So they boycott the sessions and come to the floor with a take it or leave it partisan amendment in order to cover some political concerns back home. What a shame. What a waste. And when Senator McConnell announced just a few days ago to the White House, stop negotiating, there'll be no bill before the election, there'll be no COVID relief before the election, people back in Illinois said to me, what is he thinking? Doesn't he understand the reality of what's going on in states like Illinois and Wisconsin and Michigan and across the nation? The infection rate, the death rate, hospitals being pushed to the limit? Nope. Clearly, that's not a priority for Senator McConnell and the Senate Republicans. The priority is not the millions who are at risk. The priority is not the hundreds who are dying. The priority is one Supreme Court nominee. And so we are bound to spend 5 straight days on that issue and not a minute of that time dealing with COVID-19. How do you explain that to the American people? I don't believe you can. I could go through the lengthy history, I'll put it in the record, about this Barrett nomination. But I'll just tell you that when it comes right down to it, we cannot explain how we are going to leave here Monday night voting on one nominee, but empty-handed when it comes to COVID-19. There is no excuse for that. And that's where we find ourselves. I want to tell a story of why the nomination of Amy Coney Barrett directly links up with my concern about this pandemic. Having lost 220,000 American lives, my concern and the concern of everyone is to keep our families safe. And the first question which we ask one another is, you do have health insurance, don't you? It's the obvious question. I remember a time in my own life, newly married, law student, my wife and I blessed with a little girl who came pretty quickly, and she was pretty sick. And we had no health insurance. No health insurance. She was treated by local hospitals here in Washington where I was going to law school. And they called me in one day and said, well, since you don't have any health insurance, you have three options. You can declare bankruptcy with all these medical bills. And I said, doesn't sound right to me. I haven't even taken the bankruptcy course in law school. Well, what else? Well, you can file, we think you qualify for welfare, Medicaid. That doesn't sound right either. I'm training to be a lawyer. I'm supposed to end up with a good paying job at some point in my life. Going on welfare in law school? What else is the option? Well, the only other option is we'll total up all your bills and you can pay them back to us over a period of years. It took us 10 years. 10 years to pay those bills because I had no health insurance. Did I remember that moment? I remembered it for the rest of my life. To be a father and a husband without health insurance and a sick baby, thinking, my goodness, is this going to keep the good doctors away? Will she get the treatment she needs to survive? That's what we're up against now. Because the Affordable Care Act, which I voted for 10 years ago on this floor, extended health insurance to 23 million Americans, 600,000 in the state of Illinois. And it changed health insurance for everybody. Because now the health insurance companies lost some of their tricks of the trade. They can no longer put a lifetime limit on how much they pay out. They can no longer discriminate against a person because it happens to be a woman. They can no longer discriminate based on pre-existing conditions. They've got to provide family health insurance, the option of keeping kids on the policy till they reach the age of 26. That affects all policies. So what has been the approach of the Republicans, particularly this president? He wants to eliminate that. What I've just described, he wants to eliminate. Don't take my word for it. It's been filed in a case across the street, Texas versus California. A group of Republican attorneys general came forward and said, we want to eliminate the Affordable Care Act. And the president said, I'm going to join you. Let's get rid of it. They had tried on the Senate floor in 2017. It's one of those moments etched in my memory, sitting down there at my desk, and I looked at that door over there, and it opened at 1:30 a.m., and John McCain, Republican senator from Arizona, walked through that door, stood in the well, and could barely lift that right arm that had been shattered when he was a prisoner of war, lifted it just enough to say no. That no saved the Affordable Care Act from being eliminated by the Senate. And so where do they turn if they can't get it done in Congress? Off to the courts. And why is that important in terms of this nomination of Amy Coney Barrett? Because they're bound and determined to fill that vacancy on the court before November 10th. Why November 10th? Because that's the day the court takes up the oral arguments on the future of the Affordable Care Act. And if she is not in her black robe listening to that argument, by tradition, she can't vote on whether to eliminate it or not. She sent plenty of signals in the past about what she feels about the Affordable Care Act. And my friend from South Dakota who says, you don't know how she's going to rule, there's some truth to that. She could change her mind. But I'll tell you, if you were a betting person, you'd say the statements that she made criticizing Chief Justice Roberts for saving the Affordable Care Act, other statements that she's made about the law itself suggest she will not be a friend when she has an opportunity to vote. Do we take that seriously? On behalf of 600,000 people in Illinois, you bet I do. It directly relates to this pandemic and the opportunity for people across this country to have the coverage they need. I'm going to tell a quick story about one of them. I have a photo of her here, and I want to share with people the situation that she faces. I'm sorry that I don't have that in front of me, but I'm going to tell the story anyway because I remember it. Her last name is Dannenberger. She's from New Berlin, Illinois. Amazing young woman. She's battling breast cancer. And because, here it is, thank you. When we cut corners when it comes to the Affordable Care Act, Susan Dannenberger is one of the victims. She's a fifth-generation farmer and winemaker. She's got a great little vineyard and a great little restaurant, and I've been out there with my family. She's also a two-time cancer fighter with stage 4 metastatic breast cancer. She's been through the gauntlet of medical procedures, treatments, and complications in recent years. A double mastectomy, radiation, IV, chemo, pulmonary embolisms, lung infections, and more. Her oral chemo medications alone have cost her thousands of dollars every single month, even with insurance. As a business owner, Susan offers insurance to her employees. She was relieved to learn when opening her new health policy that the ACA guarantees that she gets coverage, even with that medical history. It also allows her 23-year-old son to stay on the family plan. Here's what she says to me. Most of the times I feel driven. Making wine, running a winery is more than just a job. It's my purpose. I'm more scared than I pretend to be, and that is how I make it through. I pretend that everything's okay. But this year, it's harder to pretend that everything's going to be okay. I'm worried about the future. I'm worried about money. I'm worried that I won't be able to afford to fight cancer. I'm worried about taxes, health insurance changes, and being at the mercy of insurance companies. For Americans like Susan, with a family, a business, pre-existing conditions, there's so much at stake with this case pending before the Supreme Court and the judges and justices who will vote on it. Susan, bless you, she just can't afford for this court to strike down the Affordable Care Act. Where will she turn? Oh, you must conclude. Durbin, you're not telling the whole story. Tell us about the Republican alternative to the Affordable Care Act. Tell us about their substitute, the one that's going to save everybody so much money and provide all the same coverage. Tell us about that. Well, I sure would like to, but I can't because it's never been written down on paper ever. There is no Republican alternative. They are bound and determined to kill Obamacare with no substitute. That's why John McCain voted no. He said we owe it to the American people to give them an alternative. Sadly, unfortunately, there's still no alternative.